let me know when you're ready. Sure. Yvette D'Ath, Minister for Health and Ambulance Services.
Whenever you're ready. Oh, sorry.
Well, good morning, Queensland. I want to report good news that there are no local community cases of COVID transmitted in the last 24 hours. We have 2 new cases overseas acquired and are in hotel quarantine. We have 14 active cases currently, and we've had 3,625 tests overnight. So once again, I remind everyone in Queensland, if you have any symptoms whatsoever, no matter how mild, please make sure you're coming out and getting tested. We want to keep those test results high. Fantastic results as far as vaccinations overnight. We're hitting a new peak every single day. We've had 9,131 vaccinations yesterday. So well done to all of our amazing staff across the state that are doing our vaccinations, and thank you for our frontline workers coming forward and getting vaccinated. I'll have a little bit more to say about vaccinations in a minute, but I do want to say how great it is to be here at Redcliffe Hospital today, opening the refurbished intensive care unit. Since the Palaszczuk government came into office in 2015, we have invested more than $100 million into this Redcliffe Hospital, and we have made a commitment now to do a business case to look at a major expansion of the hospital because of the growth that we are seeing in this Moreton Bay region. And the ICU unit will have or has 4 negative pressure rooms and 2 isolation rooms, which means going forward we will be able to manage, as our economy and as our country opens up, future COVID cases, because we know once our international borders lift, we will get more COVID cases and it will be in the community, and it will be really important that our hospitals have these facilities where they will be able to isolate people and contain the virus. And it's been great as I travelled around the state to see these negative pressure rooms being built and established in each of our facilities. And I want to acknowledge the Commonwealth Government, who also contributed as a 50-50 partnership, $3.2 million into this new intensive care unit. In relation to vaccinations, we have very exciting news. I yesterday called on all residential aged care and disability workers to jump online and register their interest to get vaccinated with Pfizer at one of our Queensland health facilities so that we could get you fully vaccinated as quickly as possible. Today I can announce that we will be opening up, we will have 18 facilities, vaccination hubs, opened up over the weekend, this weekend. We will be calling on all residential aged care and disability workers to come forward and register so that we can get them booked in for this weekend to get vaccinated. If they do that, it means in 3 weeks' time we can have our aged care workforce fully vaccinated. And they are the front line of keeping our most vulnerable in our aged care and nursing homes safe and our disability facilities. So please, if you have not already and you're a residential aged care or disability worker registered, we want you to do that today. So in addition to our 15 existing sites across Queensland, we have Logan Entertainment Centre, Rockley Showgrounds and Springfield Tower. So they will all be opening over the weekend. All of them will be open on Saturday, and 10 of those will be operational on Sunday as well. We hope to do around 15,000 vaccinations over the weekend. In addition to inviting residential aged care and disability workers to get vaccinated this weekend, these sites will be open for the 40 to 49-year-olds who have registered to be vaccinated. So I want to be clear, these sites are not for the general public. It is not open to walk-ins. This is open to the 40 to 49-year-olds who have been registering with us. Over 30,000 have registered with us so far to get vaccinated, and also our residential aged care and disability workers who will get absolute priority over the weekend so that we can get them fully vaccinated. I want to thank all the staff. We have many health workers across the state who are standing up to help us run these facilities over the weekend. We hope that this weekend will be a platform for us to go forward and to build on our capacity and to further open up the services for vaccinations. I want to remind everyone, other than our residential aged care and disability workers, if you are 50 and over, you should still be going to your GP or a Commonwealth Respiratory Clinic to get your AstraZeneca vaccination. This is for 40 to 49-year-olds and these particular workers. And of course, any frontline workers who haven't already been vaccinated because they may have been on leave or for other reasons at the time are welcome to also register and get vaccinated as well. So we're really excited about this weekend. Rockley Showgrounds opened yesterday because these sites will be ongoing and we want to see as many people during the week also making sure they make a booking and come in and get vaccinated. And lastly, we saw Victoria announce changes to their restrictions, but a further extension to what they are putting in place, particularly around Melbourne, but the whole state will still have some restrictions in place. We do have ongoing concerns in relation to the local transmission of COVID in Victoria, and now we are seeing exposure sites listed for New South Wales. For that reason, we have taken the advice of Dr. Sonia Bennett, the Acting Chief Health Officer, and we will be continuing our hotspot declaration for Victoria for up to another 7 days. We will review it in 7 days' time. For those people who are already in Queensland, who are not in quarantine because they haven't been a close contact or haven't been to one of the exposure sites, and we have asked for you to comply with the previous Victoria restrictions, we ask that you continue to comply with the Victorian restrictions as they've been modified. So please, if you have been in Victoria for the last fortnight, you are in Queensland and not in quarantine, we are asking you to continue to follow the Victorian restrictions at whatever place you are residing here in Queensland. And I want to just mention anyone who's been in New South Wales to also check the New South Wales website and the Queensland website. There are 9 sites listed for Goulburn, Hymas Beach, Jarvis Bay, Vincentia, Huskisson and Gundagai. So if you have been in any of these areas in recent times, particularly since the 19th of May, please go onto the website, have a look if you've been to any of those venues and follow the advice on the website. Many of these are seen as close contact sites, which means you must immediately get tested and go into quarantine. I'll now ask Dr. Bennett just to comment a little bit further on Victoria and what's happening in New South Wales. Thank you.
Thank you, Minister. Good morning, everyone. I'd like to start by really acknowledging the fantastic work that the contact tracers in Victoria have been doing to manage what is really a very large and complex outbreak, and that they continue to do, which is why we saw yesterday Victoria announced that the restrictions to Greater Melbourne will continue to apply. One of the cases yesterday, certainly, that travelled to New South Wales still doesn't have an epi-link, so they don't know where the infection was acquired, and for that reason in Queensland we've decided to keep the current border restrictions in place, as the Minister said, and declaring Victoria a hotspot. We continue to review it closely, and we'll review it in 7 days, and we're keen to lift those as soon as possible, but we really want to provide the community confidence that when they're lifted, they'll remain lifted, and because of the uncertainty around the outbreak and the evolving situation, they'll stay in place here in Queensland for 7 days. Happy to take.
Are you looking for in order to reopen those borders?
We're really looking for, and I think Dr. Young has said this repeatedly, we're looking for some assurance that there's no unknown transmission in Victoria and in Greater Melbourne, so that, you know, most of the cases, not that there are no cases, but if new cases are detected, then there's some understanding of where they acquired their case and that they haven't been infectious in community to continue transmitting for very long.
There's no 28-day rule, no 14-day rule.
No.
We've got no cases anymore. None of that.
There's no rule at the moment about when it'll be lifted. It really is a review, an ongoing review, and as the Minister said, we'll review that in 7 days.
What are your thoughts on the push for the combination of the flu and COVID vaccination?
Well, I think that's always been an option, but it's not one that will be readily available. I mean, the emphasis on the in the first stage was really having a COVID vaccine available to everybody, and that's what we've got. And the Minister's just announced some exciting news around the opening of further community clinics this weekend, which we'd encourage everybody to take advantage of. I think in time, if there was a combined influenza COVID vaccine, then that's obviously going to be a practical solution for everyone so that they can protect themselves both against influenza and COVID with one vaccine.
Well, is there a likelihood that that 2-week in between rule could change in light of this push?
No, at the moment that 2 weeks stays in place. I think as we saw in Victoria, that was lifted. ATAGI gave advice that it was safe enough to lift if somebody is in a high risk and needs the vaccine quickly and urgently, but at the moment, as I understand it, the 2-week interval between having a flu vaccine and a COVID vaccine stays in place, and we'll take our advice from the national expert groups like ATAGI as to when that changes.
Given there's so many exposure sites now in New South Wales, how worried are you about this threat creeping up to us?
Look, we're concerned enough that we really encourage anyone who's been in New South Wales, as the Minister said, to check both our website in Queensland Health and the New South Wales website. If they've been in any of those exposure locations, then to please call our health contact centre, and the number will be there to let us know, because there's obviously a risk. Having said that, it's early days for New South Wales, and I think like any COVID outbreak in any jurisdiction, we'll know more over the next few days about whether there has been a transmission there or not. So it's largely unknown.
Is it frightening how quickly this seems to be spreading?
We've always known COVID is highly transmissible. I think what's unusual about this virus is sometimes it doesn't transmit at all, and then other times one person can transmit to a lot of other people, sometimes with very little contact, and that's the unpredictable nature of the virus, and that's why we have all the measures that we have in place, and we encourage the community, even if you don't think you've been exposed, if you've got symptoms, COVID-like symptoms, please just go and get a test, and that's what you can do to help manage transmission of this virus.
The Minister, people of all ages, including people that are under that 40 to 49-year age bracket, have been getting vaccinated at the Rockley precinct. What are your thoughts on that? How do you feel about that?
Oh, look, and I've seen some of the lines at the Gold Coast as well. I did make this point last week, which is we would prefer people to book at our sites so we can manage the lines. We don't want people waiting for hours and hours in line. We do want people booking in. We will give priority to those bookings in the eligibility groups that we have indicated. So if you're walking in outside of those groups, you may not get vaccinated at all, or if you do, you may be waiting till the end of the day to see if there's any spare vaccination. We want this to work smoothly. We want to make sure that we can staff these facilities based on demand, and the best way for us to do that is for asking people to book in. So again, this weekend, don't just walk in. If you don't have a booking, you're not getting vaccinated. This is so we can get everyone who has already put in a register of interest in those age groups, and our priority group, of course, to get vaccinated. Now, if this weekend works really well, and we get through the 15,000 at least that we'd like to, then there's opportunities for us to expand even further, not just the number of venues, but also the hours that they're operating, and more weekends going forward. Remembering that we are planning on moving to mass vaccination centres as we get closer to October, as long as the Commonwealth can guarantee that that large volume of Pfizer is going to come into the country as planned.
Does this just show, though, that this whole system has descended into chaos? You've got people lining up who aren't even eligible, who are desperate to get vaccinated.
Oh, look, we all want the same thing. At the end of the day, we want as many Queenslanders and many Australians vaccinated as possible. And if we can get to the end of the year with just about everyone who wants to be and is eligible to be vaccinated having been done at least one vaccination, that is fantastic. But we do ask people to just be mindful that we need to do this in a staged approach so that we don't overwhelm the system and that we can make sure that we've got adequate staff there and that people aren't lining up unnecessarily. So we know people are keen. I'm thrilled that people are keen, and we will expand as quickly as we can based on the volume of vaccine. Remembering we haven't opened up to everyone at this stage simply because we don't have the volume in this country that if we did, we could have people getting vaccinated above those who are most at risk and those who are potentially able to give it to the most vulnerable. So just give us a bit of time. Let's get through this weekend. I'm hoping this weekend will be very, very successful. So if you're one of the 40 to 49-year-olds and you've registered, be checking your email. If you get an invitation to book in this weekend, take advantage of that invitation. And also, again, our residential aged care, disability workers and any of our frontline workers who haven't been vaccinated yet, please, we want you to book in and get vaccinated at these new sites. I just want to remind everyone also that we still should be socially distancing. People should be continually washing their hands and using sanitizer. We should be making sure everyone checks in at venues. So this is going to be really important. We've got the State of Origin in Townsville on Wednesday night. Please make sure that you're checking in at venues, because if there is a case that happens to get across the border, our contact tracing will rely on that check-in app and people checking in at those venues. So it's really critical. And I encourage businesses who haven't got the Queensland check-in, you don't have to be in hospitality. Every single business in Queensland, if they want to, could download and get the Queensland check-in app. So I know many businesses have taken up that opportunity, including supermarkets. I welcome that, so please have a look and download this app, because I can tell you the ones who are using it love it and want to see more of that app being used across the state.
What do you say to reports that our hospital and health services are holding crisis talks and proposed cuts to those services?
Look, the Premier has been very clear, the Treasurer's been clear, and I've been clear that this will be a record health budget again in this year's budget. We are only a week and a half away from the budget being handed down for this year. Everyone will be able to see what our health investment is. But I have been working with the chairs and the chief executives of all of our hospital and health service boards. We know that their service agreements are due to be negotiated and signed up shortly, and I'll work with them. But our commitment couldn't be clearer that this will be a record health budget.
So you're saying that you're not making those cuts then?
We are not cutting their budget, we are increasing the budget.
How many of those service agreements haven't been signed yet?
Well, they're not completed as yet, we haven't got the deadline yet.
Is
We
that
haven't
normal
reached.
for them to not be signed so close to the budget?
Well, look, this has been a difficult time because of COVID, and we had a late budget late last year after the election, and then this budget this year. So certainly there's been some delays in the process, but I'm very comfortable with the way it's progressing. And as I say, the Premier and I could not be clearer that it will be a record health budget this year.
Sorry, can they be confident then that they don't need to be holding these crisis talks, or will they see those budget cuts?
Look, I don't know about crisis talks. I'm saying very clearly, the Premier has said it and the Treasurer has said it, there will not be cuts to the budget. It will be a record health budget.
Are they still going to have to make those dividend savings, though, that have been flagged previously?
They will all have an increase in their budget.
Will they
I
have to
couldn't be
make the
clearer.
dividend
They're
savings,
having an
though?
increase. It's not a cut to their budget. They're having an increase to their budgets.
But will they have to make the dividend savings?
Every agency is having to find efficiency dividends. We've been doing this for 4 years. These efficiency dividends happen across the whole of state government, which is what the people of Queensland expect. It was taken to the last election. This is nothing new. We've been making efficiency measures for the last 4 years in health and been doing a fantastic job. We are the second most efficient hospital system in the country on paper, and I would argue the most efficient health system in the country when you look at how decentralised we are. So we will continue to find savings in the system because that's what you need to do. We saw with the budget after the election, this is a tough time for all states and territories and nationally with the budget, but I could not be clearer. The Premier has said it, the Treasurer has said it, I've said it. This will be a record health budget.
How much savings will those efficiency dividends create?
This will be a record.
Everyone
Everyone will see the budget in a week and a half.
Minister, we're hearing that some people who are lining up for the vaccine without a booking are saying they're having trouble with the system and that the online booking system, and that is why they're just taking a punt and doing it. Are you hearing the problems? What are you doing to fix them?
Look, I know there was a problem with the Cairns booking system the other day, but I've been reassured that the booking system is working, that you can get online. I actually went online myself and had a look at the system again this morning. You can register to your interest to make a booking today. So I've asked the department to make sure this system is going to be able to stand up to all of those bookings. We have had very big demand. Our 1234 COVID line has been getting, I think it's around 4,000 calls a day at the moment. So we are getting a lot of calls and there's a lot of people trying to register. I appreciate that. I ask people to be patient, but please, we do want you to book in just so we can make sure that we've got the staffing numbers there and we can deal with the crowds that are going to be coming in, especially over the weekend.
Minister, back to the Rockley facility, do we know how many people under 50 have been vaccinated there?
I haven't got a breakdown of yesterday's figures. As I say, we had over 9,000, we had 9,131 across the entire state yesterday, but I don't have the breakdown of how many. This was only started up yesterday, so I suspect the numbers were quite low because we always do a soft start, but those numbers will gradually increase and I suspect increase quite quickly over the coming days and certainly be very busy over the weekend, I would hope.
Do you have any numbers for the number of aged care staff at the facilities where the vaccine is managed by the Queensland government? Do you have any numbers for how many of them have been vaccinated?
Can I be clear? We are not managing the vaccine in aged care, including our public ones. The Commonwealth was responsible for administering the vaccinations in all residential aged care, both public and private, across the state. But I am aware that all of ours have been fully done but one, and one of them is in Townsville and they started their vaccinations yesterday. But they are all being done by the Commonwealth. What the Commonwealth's not doing is the workforce, and we are calling on the workforce to come and we will get them vaccinated.
Out of that workforce, though, do you have the numbers?
We don't have the numbers because this was being managed by the Commonwealth. We don't have exact numbers because the Commonwealth moved from saying they would vaccinate all residents and workers in residential aged care and disability services to asking the workforce to go see their own GP to get vaccinated. So we don't know the numbers, and that's why we're asking people to register their interest because any worker across the state who works in this area, we want you to come forward and get vaccinated. We can't go to them because we don't know which ones have been vaccinated and which ones haven't. So that's why we can't take it into the aged care. That wouldn't be an efficient way to do it. We're calling on them to come to us, but we will make sure they're front of the line and we will make sure they're getting Pfizer, no matter what age they are, so that they can be fully vaccinated within 3 weeks of their first vaccination.
Minister, do you think it should be compulsory for those working within the aged care and disability sectors to be vaccinated?
Look, these are discussions that would be had at a national cabinet level, but we will continue. There is no decision to make it mandatory at this stage across any area of the professions. However, we strongly encourage. I strongly encourage all of our health workers, our police, our paramedics, our emergency service workers, and I strongly encourage all of our residential aged care and disability workers to come forward and be vaccinated. If they have any nervousness around that, then go see your GP. Go see your GP, irrespective of which vaccine you're getting, and have that conversation just to address any anxiety you have. But I strongly encourage them to come forward. We do not want a situation where COVID gets into our nursing homes and infects our residents because a staff member has brought it in because they weren't vaccinated.
What are your thoughts on the COVID vaccine patch being developed by you scientists to see people self-administer?
I welcome any innovation in this space. I think it's really exciting that it's a Queensland innovation, and we will wait and see. I mean, these all have to go through trials and a whole lot of other assessments and get approval with the TGA, but there is great work being done in Queensland around COVID, around vaccinations, and also ongoing treatment for patients who have got COVID, so they don't end up seriously ill and can recover quickly. So really exciting news, but there is work being done all over the globe, and I have no doubt that we'll see so much evolve over coming months. We don't know what we'll be dealing with next year as far as what vaccinations will be available and how we'll get those vaccinations.
Minister, how concerned are you about the Indian variant?
Again, I believe there's still evidence being gathered on whether the Indian variant is more contagious. We know the UK one is. We've seen that ourselves. We've seen that the UK variant has been one of those ones that has transmitted from room to room in our corridors, in hotel quarantine, in various jurisdictions across Australia. So, we're concerned about COVID. It doesn't matter what strain it is, doesn't matter what variant or mutation it is. COVID is deadly. That's why we have done what we have done in Queensland. It's why we take the measures that we do. It's why we are continuing to declare Victoria as a hotspot, because we know how deadly this virus can be.
Are enough people coming forward to get tested at the moment?
I would like to see higher testing numbers. We know that there's plenty of people who are starting to get head colds and feeling a bit fluey out there. It's the season for it. But please don't assume that that's what it is. You don't know if that's what it is. If you have any of those symptoms, then please come and get a COVID test. And we want that to be a regular thing. Every time you start getting that sore throat or that cough, not only spending the day in bed to feel better, go and get your COVID test and make sure that you are negative. It's the only way we're going to keep our community safe. Thank you.